What is drug addiction treatment? Drug treatment is intended to help addicted individuals stop compulsive drug seeking and use. Treatment can occur in a variety of settings, take many different forms, and last for different lengths of time. Because drug addiction is typically a chronic disorder characterized by occasional relapses, a short-term, one-time treatment is usually not sufficient. For many, treatment is a long-term process that involves multiple interventions and regular monitoring. There are a variety of evidence-based approaches to treating addiction. Drug treatment can include behavioral therapy, such as cognitive behavioral therapy or contingency management, medications, or their combination. The specific type of treatment or combination of treatments will vary depending on the patient's individual needs and, often, on the types of drugs they use. Treatment medications, such as methadone, buprenorphine, and naltrexone, including a new long-acting formulation, are available for individuals addicted to opioids, while nicotine preparations, patches, gum, lozenges, and nasal spray, and the medications varenicline and bupropion are available for individuals addicted to tobacco. Disulfiram, acamprosate, and naltrexone are medications available for treating alcohol dependence, which commonly co-occurs with other drug addictions, including addiction to prescription medications. Treatments for prescription drug abuse tend to be similar to those for illicit drugs that affect the same brain systems. For example, buprenorphine, used to treat heroin addiction, can also be used to treat addiction to opioid pain medications. Addiction to prescription stimulants, which affect the same brain systems as illicit stimulants like cocaine, can be treated with behavioral therapies, as there are not yet medications for treating addiction to these types of drugs. Behavioral therapies can help motivate people to participate in drug treatment, offer strategies for coping with drug cravings, teach ways to avoid drugs and prevent relapse, and help individuals deal with relapse if it occurs. Behavioral therapies can also help people improve communication, relationship, and parenting skills, as well as family dynamics. Many treatment programs employ both individual and group therapies. Group therapy can provide social reinforcement and help enforce behavioral contingencies that promote abstinence and a non-drug using lifestyle. Some of the more established behavioral treatments, such as contingency management and cognitive behavioral therapy, are also being adapted for group settings to improve efficiency and cost-effectiveness. However, particularly in adolescence, there can also be a danger of unintended harmful or iatrogenic effects of group treatment. Sometimes group members, especially groups of highly delinquent youth, can reinforce drug use and thereby derail the purpose of the therapy. Thus, trained counselors should be aware of and monitor for such effects. Because they work on different aspects of addiction, combinations of behavioral therapies and medications, when available, generally appear to be more effective than either approach used alone. Finally, people who are addicted to drugs often suffer from other health, e.g., depression, HIV, occupational, legal, familial, and social problems that should be addressed concurrently. The best programs provide a combination of therapies and other services to meet an individual patient's needs.